Physiotherapy is a type of healthcare profession that focuses on the physical rehabilitation and treatment of individuals who have suffered from an injury or illness. Physiotherapists use a number of approaches to assist patients in recovering from disease, injury, or disability. These techniques include exercise, manual therapy, hydrotherapy, and electrical stimulation. Physiotherapists also provide patient education and advice to help patients maintain their health and prevent future injuries or illnesses. Types of physiotherapy. Manual therapy. This form of physiotherapy employs manual manipulation and mobilization of joints and soft tissues to relieve pain and increase range of motion. Additionally, it may incorporate massage, joint mobilization, stretching, and other therapeutic activities. Exercise therapy. This type of physiotherapy focuses on prescribing specific exercises to help strengthen muscles and improve overall physical fitness. Exercises may include stretching, strengthening, balance training, aerobic conditioning, and core stability work. Postural re-education. This type of physiotherapy involves teaching patients how to properly position their body in order to reduce pain or improve posture. It may involve instruction in proper ergonomics or postural correction exercises such as Pilates or yoga. Electrotherapy. Electrical stimulation is used in this sort of physiotherapy to alleviate pain and improve muscular strength and coordination. Ultrasound therapy, transcutaneous electrical nerve stimulation, TENS, electrical muscle stimulation, EMS, and interferential current, IFC, are typical forms of electrotherapy. Aquatic therapy. This type of physiotherapy is used in a pool setting for patients who need assistance with mobility due to arthritis or other medical conditions that limit movement on land. Aquatic therapy can involve low-impact cardiovascular exercise as well as strength training exercises using buoyancy aids such as noodles or water weights. Benefits of physiotherapy. Improved mobility. Physiotherapy helps to improve mobility by strengthening muscles and increasing flexibility. This can help individuals move more easily and safely, reducing the risk of falls or injuries. Reduced pain. Physiotherapy techniques such as massage, stretching, and exercise can help to reduce pain associated with various conditions such as arthritis or back pain. Improved posture. Poor posture can cause pain and discomfort in the neck, shoulders, back, and other areas of the body. Physiotherapists use exercises and stretches to help correct posture problems and reduce strain on joints and muscles. Improved balance and coordination. Poor balance or coordination due to age or an injury can lead to falls or other accidents in people who are not used to being active. Through exercises designed specifically for balance improvement, physiotherapists can help individuals regain their sense of balance so they are able to move more confidently throughout their day-to-day activities without fear of falling or injuring themselves further. Injury prevention and rehabilitation. Physiotherapy is often used as part of an injury prevention program for athletes or those who participate in strenuous activities regularly. It helps strengthen muscles, which reduces the risk for future injuries from happening again by providing support during activity that may be too strenuous for one's own body strength alone. Why is physiotherapy done? Physiotherapy helps to restore movement and function to areas of the body affected by injury, illness, or disability. It is used to improve range of motion, reduce pain, improve strength, and help people regain their independence. Physiotherapy can also be used for prevention and rehabilitation purposes. It helps people with chronic conditions manage their symptoms more effectively and can help prevent further injury or disability.